Hey everybody, a lot of us are having a little bit more time on our hands at home these days, and it may be where you're taking a little closer look at yourself in the mirror and thinking you want to go for some enhancements. Maybe there's things you want to improve about yourself. So today I'm talking with Dr. Christie, and she has a philosophy called the Beauty Matrix, and she does a lot of these procedures to help people maybe boost their self-esteem or improve their looks in one way or another. So I want to welcome her and thank her for joining us today.
I think we're seeing, a lot of people that are staying at home and kind of analyzing their face. I've been getting a lot of messages from women who maybe just have a moment to pause in their life and evaluate maybe things that they have not neglected in the past because they're so busy. We also have a lot of people that are doing things like us, like Zooming all the time. And so that sort of puts your face on camera that you're maybe not used to and makes you analyze things, maybe not loving what's looking back at you. So this is kind of actually where the beauty philosophies that I've kind of developed really are a great start to help patients figure out what the next best step is. So you start off saying, hey, I'm not sure what I don't like and what I like. Also, we're sort of inundated with Instagram and celebrities, influencers, and there's so many different treatments. So I think it can be really overwhelming for consumers to figure out, well, what should I invest in? What's the next best step for me? So the Beauty Matrix.
I think a lot of times, we're looking at these pictures and things like on social media, as you mentioned, there's lighting, there's a lot of little tricks, but as far as what you look like every day, tell us a little bit about your background and how long you've been helping people achieve some of their desired looks.
I am a double board certified general and plastic surgeon. So I've been doing surgery for the past 10 years now. I do a lot of breast cancer reconstruction, and then I definitely have a very high population of executive females, I would call them, who are very much boss ladies, and they're really looking for a lot of the minimally invasive treatments, starting off slow, and they want sort of a very natural balanced approach. And that's where I combo a lot of the technology with surgical procedures to get those results. And it's a challenging part because there's also minimal downtime that they have, and so I think that's where I've developed a lot of my treatment strategies, is based on trying to accommodate what my philosophy and beauty aesthetics are with the patients and their downtime and the available treatments that are on the market.
Yeah, and I've heard that men actually are opting for it more often now because they feel like it helps them in the workplace too.
For sure. I mean, I think, yeah. I think, men are really behind the game on this stuff. I think, one of the things that I really like to do for guys is give them a little bit more of a simplistic routine, and part of the Beauty Matrix is really understanding the problem. We have to understand the problem to develop a cure. And so for a lot of guys, they really can't, they don't understand what they're doing, and their wife just tells them, or, they think, hey, I saw this on the internet, maybe I should do it. It's very overwhelming for them. So it's just really simplifying, this is your problem. This is your highest yield category. And then this is the treatment that's going to best suit that for you,
Very nice. So tell me more about your Beauty Matrix and your philosophy.
Yeah. So the Beauty Matrix is essentially a treatment strategy that I developed. And that's really to guide patients in the aesthetic world. So it's, like I said, really first starts with identifying the problem. So it works in three ways. First, you identify the problem that you have with aging. And then the second part of it is that you identify your primary problem. So one of those three categories. And then lastly, you base those, whatever treatment you choose based on your primary problem. And that helps you over time to have a balanced approach to aging and also work through each of those categories, because aging is a sort of an evolution, and there's no one sexy treatment that does everything. If you look at what most people who we admire are doing, like a lot of the celebrities or influencers, the reality of it is they're constantly doing little things that over time culminate to a nice upkeep of all of the components of aging.
Right. And so when you go into it, I guess you kind of have to have a plan of action of what works for you, what are your goals, because like you said, there's not one fix all, but you don't want to go the wrong route and look completely
right. And I think exactly. And this is what, my Beauty Matrix really was to cater to women who really want to have a natural aesthetic. They want to look like themselves. They just want to look like the best version. I think we all say that, but then the reality is that sometimes you go into a med spa where maybe you're not guided by a physician or somebody who actually has expertise for a long-term treatment strategy. And then you end up kind of just treating one category of aging. We see that with, sort of the over filler face syndrome trend that we're having, where people are just using volume to correct laxity, when really that's actually, I look at it more as like a Band-Aid, approach, including Botox, where you're really not treating the underlying problem. You're just kind of temporizing things. So I think, that the beauty matrix basically helps to strategize a treatment strategy. So basically it works in reverse by saying we have to understand the problem to develop a cure. So the three problems that we have in aging, I like to categorize very simply. It's skin quality, skin laxity, and then volume. So the quality of our skin is basically, how hydrated you are. Do you have a lot of prominent pores? What's your texture like? Is it rough or smooth? What kind of bounce back you have in your skin when you
Oh,
retract it? Yeah, when you snap it back. That kind of gives us an idea of, how thick is your skin? What's the sun damage that you've had? Does it look very dry? And that's quality of skin. That's a high yield category. I mean, I can never overemphasize the need for making sure that your skin ages well with you over time. You have good components of collagen and elastin, and that's how, if you look at like baby skin versus aging skin, those are the difference. You really have a change in the composition of your skin. And
wow.
then laxity is the next one. So laxity is one of those things that most people will notice. Like, I have saggy skin. They don't know if they're a candidate for, something minimally invasive, or they have to have surgery. So if you think about laxity, it's really just how much extra skin you have. So as a surgeon, I like to be very practical about this. Essentially, to get rid of skin, we either cut it out or it has to tighten in some way. And so figuring out whether you're, a candidate for surgery versus minimally invasive stuff depends on the degree of laxity. And when you treat your skin quality, you can actually change some of how much extra skin you have too. So that's why they kind of go hand in hand. And in general, I'll say quality is always the highest yield first category for most patients. So laxity is really just, if you can pinch a lot of your skin, that's what we would have to cut out, you
Uh-huh.
know, and there are different degrees of pinching. I generally say if you have about 2 inches or more, you're probably not a great candidate for minimally invasive stuff, but that is also very individualized based on your specific skin type. And
Got it.
then volume is the last category. So that's a category that I think has been really overused in the Instagram world, where it's just, it's fillers. So a lot of people are actually like augmenting their face when it's not really representative of volume loss with aging. So
Hmm.
that's a little bit different. But generally, when we're saying we all have volume loss as we age, those are things that, most people will notice as like some hollowing in their temples. Maybe you have some prominent nasolabial folds, or your lips are not as hydrated looking. And so
Hmm.
those are things where, I think fillers are very sexy, they're very cool, they're easy. So patients tend to go for that as a first category. But you can really create disharmony in your face if that's your only modality for treating your aging, where you're just filling your face with fillers and you're actually changing some of your, the way that your soft tissue sits on your bony structure, and you start looking very puffy and you've lost a lot of structure in your face over time. On top of that, I don't think it's the best investment as a first investment, because it is something that's a recurring cost too.
Right.
So, treating the quality of the skin is always, I think generally step number one for most of us. If you have perfect skin, then we can kind of, move to the other categories. And I usually will leave volume replacement as sort of the last part of it. And remember, each year is sort of an evolution. So that's why, having a good person to guide you is really, I think, one of the most important parts, where, we do something one year and we say we take a little break. We're really happy with the results. We move on to, hey, now next year we've got a new treatment strategy.
Awesome. Well, these are some really great tips and advice, and really things to think about as we do take a closer look at ourselves in the mirror when we have a little more time these days. How can people get more information from you or keep up with you and some of the different treatments that you do, and also your beauty matrix philosophy?
Yeah, you can find me online at www.drchristiela.com. You can also follow me on Instagram at dr.christie. And I receive lots and lots of messages from patients. I get, do lots of personalized cares. We do Skype consultations. Yeah, and that's one of
All
the
right.
modalities. And there's lots of other ones I'm here.
Dr. Christie, thank you so much for taking some time to talk with us today. Very fascinating, lots of good insight, and I like that beauty matrix approach. It sounds like a good way to go about things without just doing it. Think
Yes, yes. Yeah, so I just figure out your problem, and then you say, this is my number one category. For me, it's actually skin quality. I struggle with those things, and so that's where I spend a lot of my energy and time in terms of treatments.
Yes, have a plan. Appreciate your
Yeah,
time, and you take care and stay safe.
thank you so much. You too.
All right.